Bora General Hospital with Great Lakes Peace Center, Uganda. We are sharing our community experience while delivering services to the viral hepatitis B clients during COVID-19 pandemic. Great Lakes Peace Center is a grassroots youth-led organization collaborating with Great Lakes Peace Center and Bora General Hospital are passionate about implementation of SDGs within our indigenous community, specifically taking on Sustainable Development Goal 3. We are strategically carrying out specific interventions to scale up and look after people with hepatitis B in the most effective and efficient way during this pandemic. We started lockdown restrictions mid-March, restrictions on public gathering, closure of education institution, border ferrying people, mobile markets, salons and arcades have been kept in place, and 7 p.m. to 6:30 p.m. It's during the curfew. It's during this COVID-19 restriction, given the terrain of our region. On the foothills of Rwenzori, a vast number of clients were unable to come for screening, testing, vaccination, and refill of drugs. Due to long distances, they move from the mountains. Usually used borders to go to the health facilities. During this difficult time, most of the elderly people and other clients are unable to come for refills of their drugs. With guidance of GLPC, AIDS infection, diabetes, hypertension, and terminal illnesses under palliative care, we formed a team of health workers in our clinic to continue offering services during the lockdown to the peer groups, carrying out screening, testing, vaccination, treatment, and managing and care at the hospital. We agreed with the peer chairpersons and coordinators to profile clients who are in the mountainous areas so as to deliver drugs in their distant places, including Bwambale, Ihandiro. Fruits of our interventions, we are delighted to deliver refills for elderly people and those suffering from viral hepatitis B infection during the month of April, May, June, July, and August. May, June, July in our communities of Mpondwe, Isango, Karambi. We delivered to about 240 people living with the viral hepatitis on the monthly basis. We are delighted to deliver refills for elderly people and viral hepatitis infection people in Isango. We carried out static-based client screening for patients within our mapping areas, those who are able to come to the health facility. We provided a table phone call for clients to call in for appointments, counseling, health education, information sharing, and communication to the grassroots members. Way forward, we are referring clients to the health center 3-4 to be further referred to hospitals so that workers can further screen them, health inform, communicate about the burden of viral hepatitis B. The clients can be investigated for CBC, viral load, and other therapeutic managements. We are carrying out social media platforms, Facebook, LinkedIn. We boost of huge young people following our Facebook accounts, WhatsApp, LinkedIn, Instagram, and Twitter, that we always get feedback and reassurance. We have been calling upon our leaders to listen and focus on political will and commitment from the leaders, religious leaders, and governments to avail funds and do the investment. We agitate for introduction of the birth dose for young people. We also ensure all pregnant mothers who visit antenatal are screened for mandatory hepatitis B. We need to strengthen the health system cold chain to ensure vaccines have efficacy. As we may be aware, most of the births in Africa occur outside health facilities. Therefore, there is need to strengthen the link between community health workers to ensure the mothers give birth in health facilities. Indeed, there is no way to peace. Peace is a way with inclusion of young people to spearhead and champion hepatitis elimination as it's getting to 10 years of viral hepatitis elimination by SDG 2030. Building peace to bridge nations. Thank you very much.